All my medic and nursing school friends, listen up. We are about to get you an A on your electrophysiology exam. Let's go over the cardiac conduction system. It really isn't too hard. So as you know, the heart begins its electrical signal in the SA node, the sinoatrial node, and that little nugget hangs out in the right atrium. But we want both atria to contract at the same time just before the ventricles contract, because remember, the atria are the two smaller compartments of the heart at the top, and we want them to squeeze and squirt blood into the ventricles. And right after that, the ventricles give a big squeeze because they have a much bigger push to be able to. Right side pushes the blood into the lungs, the left side pushes blood out into systemic circulation. So how do the muscles of the heart know when it's their turn to contract? It's this cardiac conduction system. And lay off, I'm not a graphic designer. I'm a nurse educator, and this took me 1,000,000 years to make this graphic. So the signal starts in that sinoatrial node, and that's capable of generating an impulse of 60 to 100 times per minute, right? That's your normal heart rate. So it jumps across from the right atrium to the left atrium by the internodal pathways in the Bachmann's bundle. And that also sends it through the right atrium, so both atria go at the same time. Then the signal goes down to the AV node, the atrioventricular node. That makes sense because it's right in between the atria and the ventricles. The AV node is going to hang on to that signal for about 1/10 of a second because we want a little bit of delay for time for the atria to squeeze so that the ventricles don't squeeze too early. So then when that signal passes through the AV node, it goes through the bundle of His, which is like one big fat power cord, and then it bifurcates into two sides. And we have the right bundle branch and the left bundle branch, and that runs through the septum. That's the wall in between the ventricles. And down about at the bottom, it splits into the Purkinje fibers that dissipate the signal throughout the ventricles so that the entire ventricle can go all at once. So see, it's not that hard. The cardiac conduction system. Okay, but wait, I forgot about a couple things. So if the SA node that generally produces the beat, if that fails, then it's up to the AV node. And the AV node can produce a heart rate of about 40 to 60 beats per minute. But if the AV node fails, then it falls onto those Purkinje fibers to generate the beat on its own right there in the ventricles. And that is not capable of generating a fast enough beat, and you're only going to get about 20 to 40 on your heart rate when it's being generated right there in the ventricles.